Welcome to Learning Unit number 2. In this learning unit, we're going to look at how our vulnerable populations, also called marginalized groups, are often subject to unfair prejudices that stem from our own, which is healthcare providers, implicit biases and discrimination, and how these biases lead to healthcare disparities. And we're also going to look at health literacy at both the personal and organizational level as we identify actions that we as nurses can take to promote healthcare equity. And this is especially important as we focus on our vulnerable population. And we're going to end this unit by completing and submitting assignment number 1, which is the identification of our selected population. So the learning outcomes are to identify groups of people that are frequently impacted by biases and who therefore are at increased risk for healthcare disparities. And what are the actions that we can take at the interpersonal and institutional level to promote equity in healthcare? And then changing over and kind of looking at the characteristics of both personal and organizational health literacy and patient and system level factors that contribute to the challenges that our patients with limited health literacy face. So you're watching this video and then you're continuing on with your readings from Compassionomics. And this week you're going to be reading chapters 2 and 3 in Compassionomics. And there's a video by David Williams about how racism makes us sick. And I really enjoyed this TED Talk by David Williams and think you will too. There is a chapter on improving communication and from our ebook. And but again, I took this chapter and I provided it to you without having to get on to our databases at the library. So it's chapter 15, a focus on limited health literacy. That's the key readings for the week. And then when you look at health literacy in this folder, you're going to find just 3 things. The first one is nothing that you have to definitely click on, but it's new definitions of health literacy that were released in 2020. And I think you're going to find those definitions very important to know for this learning unit. And then there's 2 CDC websites that are links to CDC websites that speak to health literacy. Very brief information on each site, but I ask that you look around and learn more about health literacy because that is the goal of this week, one of our learning outcomes. And then the final is an article, well, it's actually a link to an article in Medical News Today that is on biases in healthcare. And it's a great, on the second page, there's a picture of what groups are often that healthcare providers and institutions have biases against specific groups. So I'll let you look at this, but I think you're going to find that this is another key for this week. And you're going to be doing your discussion board, no reply this week because you do have enough readings, and I want you to just highlight the unit's readings on health disparities and health literacy. So you're going to be looking at the biases, especially if you, as you're reading the information in this article, you really see that it pertains to your vulnerable population. Or as you've read through the information on health literacy, what information really pertains to your vulnerable population and can be used as you're completing assignment number 1. So I've tried to tie it in so that I'm providing you with some information so that you can go ahead and do the last thing, and that's assignment number 1. This is just a 2-page paper. That's not including the title and reference page, that asks you to really answer 4 questions about the vulnerable population that you chose in our wiki. So describe this population and why you chose this population. What makes them vulnerable? So you're going to include some pertinent demographics of your population. What are the implications for nursing practice? And then one last thing, is there a website that healthcare providers, not the layperson, but healthcare providers can find helpful when caring for members of this population? So that's to get you going on developing your expertise and knowledge in your vulnerable population. So when you click on here, that's going to take you right to the link so that you can upload your document. So I hope you have a wonderful week. Actually, the readings aren't as overwhelming as I think they might sound. The readings in your Compassionomics book, I think, go relatively quick. There's some, and then there's just some short readings on health literacy, your biases in healthcare. That's a quick read as well, and then chapter 15 in our ebook. So have a great week, and give me a buzz if I can answer any questions or help you out in any way with this course. Thanks.